Can you speak up?
Alright. Can you please state your name and your position here at Friend for Life?
My name is Wanda Dudley, and I'm a Kent School student, get my Master's of Social Work, Psychosocial Oncology, and so I'm doing a practicum for the year with Friend for Life.
I'm Nicole Guffey-Wiseman. I'm Assistant Director at Friend for Life, and I do a little bit of everything here.
And I'm Judy Casey Hewlett, and I'm the Executive Director of Friend for Life. Sounds very fancy. And I've been with Friend for Life since 1999.
What does your organization do, and who do you primarily help?
We provide one-on-one support to people who are recently diagnosed with any form of cancer. We have right around 300 volunteers who are cancer survivors, wide variety of kinds of cancer, ages, we have men and women, and some caregivers, and they go through a training to prepare them to provide one-on-one peer support to other people. So it's mostly emotional support, but it's also like, so did you have this side effect or that? So that's, but it's somebody who's been there to talk to.
What services do you provide?
What Judy was talking about is primarily the main service that we provide, the matching with the newly diagnosed patients with a survivor that's been through a similar diagnosis. We also have a few other programs, things like talking with the medical students and nursing students at U of L, and also Galen nursing students, and that's our volunteers talking to the students about kind of the patient perspective, going through a cancer diagnosis, specifically about communication. So whenever you've been diagnosed, the things that your doctor can say or do that can be helpful for you or detrimental, that kind of thing, in dealing with the diagnosis. Those are the couple main things that we do. We have a few events throughout the year, but that's most of it.
What is the most difficult part of your job?
There are many difficult parts. There are many really wonderful parts. I would say for me, if we have trouble matching someone, but especially when we get calls for people who have financial needs, and there's a lot of that, and it might be that they don't have any financial resources, or that they're falling in between the gaps where their insurance doesn't quite cover what they need, and that's the day-to-day stress. So that's difficult because that's not really what we do. So we try to link them with other resources. There just aren't enough. So I don't know if you all have any additional things that are hard.
Also, just being able to support people when they have so many other things going on, and just the sheer amount of people that are diagnosed with cancer, because it's either about 1 or 2 or 1 in 3 people have cancer at some point in their life. So it's pretty much impossible to not find somebody that's not affected, whether it's directly themselves or somebody that they really care for. So just being able to provide for all those folks and make sure that they get what they need can be tough.
What do you feel is the least understood thing about the people you serve or the people you work with?
The one I came up with for this was sometimes when people will confuse us with hospice or hospice, they think if you're dealing with people with cancer, you're dealing with people who are going to die, and obviously everybody's going to die. But our volunteers are survivors, and they're focusing on carrying on with life. And we have 300 survivors or close to that. So it doesn't, cancer used to be seen as a death sentence, and a lot of people still see it that way, and it's not.
What do you think might help people better understand this? Like better understanding what is not understood?
I think kind of the work we do is just educating about people, and we just had a session this morning with some nursing students. These women who are, you would never know they've been through cancer, and yet because they're leading active lives, they look fine, they look great, and so in that sense, just by being out in the community and letting people know, I had cancer, but I'm doing great. So I think that's part of it.
Why do you think this particular injustice continues to happen in our world?
By injustice, you mean what? Cancer? Why does cancer continue to happen?
Yes.
Do you know that Kentucky is like the #1 state for cancer? And so it could be environmental, it could be the food that we eat, it could be a number of things. Like in the west end of Kentucky, where the what are those fuel was it
Oh,
the old
gas.
gas fuel pumps?
Brownfields.
Have you been? It's on Northwestern Parkway, Southwestern Parkway. You should drive past there. There's a number of gas. I think it's gas and fuel, and so that pumps the water. You know, the people are drinking the water. We're high smokers here. Our diet is not good. High diabetes, weight. So all those things, you know, are causes of cancer. So I don't know if it's an injustice or just a part of what we do and how we're living.
Yeah.
And I would just add to that, that looking at the state of Kentucky, Appalachia is one of the worst areas. And there are high rates of poverty there, and people are living in isolated areas. So there are just so many factors, and the poorer you are, the more likely your health is to be poor for all sorts of reasons. So there, to me, is a huge injustice to add to what Wanda said.
And that culturally, there's a big piece of it, particularly in eastern Kentucky, that people really just don't talk about cancer. And there's a whole idea of fatality that if you have cancer, like you were mentioning before, that you're probably going to die, but that's not necessarily the case. And just knowing that they can get treatment and that there's support and treatment available to them. But there are a lot of difficulties that play into that: distance, culture, poverty, just all kinds of things.
What are some factors that contribute to this happening? You all kind of just touched on that. You said like poverty.
Kind of, yeah. And there's another factor that I didn't know about until a couple of years ago, was radon. I didn't realize that the nature of the lay of the land in Kentucky, that we have all the caves and different kinds of layering of sediment and everything, that there's a lot of radon in the state, which also leads to lung cancer. So just there's so many different pieces and parts, and lack of education, and just a lot of things.
Who do you feel has the power to change this situation?
I think we do.
Mhm.
I think technology, doctors have gotten better with it. As a social worker, University of Louisville is the first college to have social workers that have a specialty in oncology. And so I think we're becoming more knowledgeable about cancer. We're also catering to the patient instead of just the cancer. We're looking at the patient itself, not just the cancer, but seeing how we can help you deal and live with cancer.